Today is a great day. Can I say that? No! Finger. I have no idea. Hey guys, it's Manda, the CMA here again. If you are a returning viewer, welcome back. If you are new to my channel, I talk about anything and everything medical assisting and beyond. So make sure to subscribe if you are not already subscribed, as I have said in the past.
I don't know why you're not subscribed to my channel. You might as well just do it.
Anyway, so what we are talking about today, I'm sure you saw the video title. It is called Medical Assistant. I am not a nurse. And I think this is a very big issue to bring up. I know it can be kind of controversial, so if you do not like my video today, please skip the thumbs down and move on to the next video. What I will be talking about today is just the differences between a nurse and a medical assistant. We are actually two completely different entities. I would normally say it's apples to oranges, and what I would actually say is that we are like apples to grapes. So if you're wondering why I think that, make sure that you stay tuned and let's get started with today's video. So the first thing about this video today is that I want you guys to understand that it is going to be serious starting off, and then I want to make it a little bit more funny and a little bit more interesting at the end. So please stay with me for a while. If you are a medical assistant, there's always this cloud that kind of hovers right over you. And over the past 6 years, I've heard so many patients ask me, am I a nurse? What is a CMA? Are you a nurse? And the easy answer out of that one is yes, I am a nurse. Because we don't want to sit there for 15 minutes trying to tell the patient what a medical assistant is, unless you want to show them my first video that I ever made that's completely embarrassing, to sit them down and tell them exactly what a medical assistant is. This is one of the reasons for my channel, is what is a medical assistant? And most patients don't know. There's so many things that are so different but still the same about us. I understand for nurses out there, you've gone through a lot more than we have. You've been trained in a hospital setting. You've been trained for many, many different things, how to take care of many different disorders, and you can make patient care plans. You can do many other things that us medical assistants can't do, that we haven't been trained to do. And I completely love you guys, and I have no disrespect for you at all. Now, the thing is that I completely understand that I am not a nurse, and I think many of you out there don't expect to be called a nurse when you go to medical assisting school. You're being a medical assistant because that's what you want. Maybe you had the path like I did and you wanted to be a nurse and it just didn't work out for you, or you want to start off as a medical assistant and then go on to be a nurse. But by going to medical assisting school, mostly what I've learned is that medical assistants are fully aware that they are not nurses. So, you know, we're just playing our part. What we should understand is that nurses go through a lot different training than we do. They go through complete and utter patient care. That's what they are there for. I wouldn't say that medical assistants aren't there for patient care. It's just that we are so versatile in the clinical setting where we are meant to be, that we are different from nurses in that way. Nurses are meant to be in clinics, nursing homes, assisted living, and the hospitals, of course. So we don't have the chance to be able to do that. I think that it's something that both nurses and medical assistants need to agree on our differences. This video, it gets kind of in-depth and it gets kind of serious, and I hope you guys really understand and take this as just my side of how it is. So let me tell you actually a backstory about this video. From working in the field so long, I'm pretty well versed with a rebuttal to somebody that thinks poorly of medical assistants. But I was a little excited. I know this sounds weird, but I was a little excited because I found my first troll on my channel. If you guys don't know what a troll is, they are somebody that only watches your videos so that they can complain and be mean to you, pretty much. I love to be able to tell my side of the story. So thank you for helping me with this video. They don't actually get any fame for making that troll of a comment that they left, but they did make for a good video, so hopefully you guys are enjoying so far. Let me start drawing everything out for you. So here's my handy dandy chalkboard that I have. And I know you guys love this chalkboard so much. So we are going to make an apple here, and we are actually going to label that as a nurse. So the inside of this apple is complete and utter patient care. So let's label the inside of that. There is no other thing other than patient care practically here for these nurses, and they work very, very hard for what they can do for those patients. They can do triage, they can take vital signs, they can do medication administration, which if they are certified or able to, they can do IVs, they can administer oral medications and they can make care plans for patients that are in hospital or hospice. They can also assist with surgeries. They can do anything that is a nursing assistant duty, so anything that is a daily normal activity for a normal person. So brushing their teeth, helping them get ready for the day, everything that they could possibly do. They can also interpret tests, certain tests anyway, instead of having the physician do that for them. So what we're actually going to do here is we are going to erase the whole entire thing. So I have a little bit more to speak on, and we'll talk about a little bit more that these nurses can do. So let's draw that apple again, and we'll label it nurse here. Now every apple has seeds, which means that these nurses can grow into a lot of different things, and they can move up. So they have the chance to become any kind of instructor for nursing, so they can teach everything that they are able to do themselves usually. If they move higher up in the system, they can also become DONs, or directors of nursing, where they take care of the whole nursing staff at a lot of different facilities. They can also move up to be an advanced practice nurse, so an APRN. Another thing that they can do is become a nurse anesthetist. So they would be right underneath an anesthesiologist. They're able to give IV anesthesia. They can help out with surgeries and just go over patient medication. They can also become a first assistant for surgeries. So instead of a physician assistant or maybe a surgical technician being the first assistant, the main assistant for a physician, they would be the ones that can do that. So let's move on to the next one, which is the medical assistant. So let's explain why they would be grapes, or why we would be grapes. So we do a lot of different things, so we can't just be confined to one kind of fruit, I guess, if you want to say. We can work in the lab, we can do a lot of different things in the lab. We can also do vitals for patients. We can work x-ray if you were x-ray certified, which a lot of schools actually do not offer that. We can work directly with a physician, which is something that I do. So if you haven't seen that video, you can check that one out. We can also help with minimally invasive procedures, which means anything like a hysteroscopy. We can help out with different incision drainage kind of things, like if you're a dermatologist's office. We can also administer injections, which is quite common for us, so any kind of flu shot or anything. We can take phone calls from patients, help answer their questions, refill their medications if they need that. We can also be in medical records, so that's definitely a possibility for us. We can be schedulers, helping out with putting appointments on a doctor's schedule. We can also be care coordinators. So that means anything from surgeries, helping out with getting them scheduled for MRIs, a lot of different things that would be an outside source. We can also do patient counseling, which patient counseling is something else that I actually get to do. This is where you're informing the patient of how to move forward, what the physician has that they want them to do. That next one that I wrote there, I have no idea what I wrote. But other than that, you can run an autoclave, which I know at my office, since we use a lot of instruments, that is something that I do quite frequently. We can also do phlebotomy. So as you are taught in school, we can do blood draws, we can do finger pokes, anything like that. We can also do sterile procedure setup. So we can set up for those minimally invasive procedures as well. We can also administer certain medications that are okayed by the physician. So anything like a injectable medication or ibuprofen or something. We can do billing, which kind of speaks for itself. We can also work in collections, which I know sounds like a great and fun part of medical assisting. We can do anything that is part of a protocol. So if there's a protocol that is specifically made for medical assistants, we are able to do that protocol. And we can also do anything under a physician's care. So if a physician is going to let us do something within a certain means, we are able to do that. Now, I'm sure you guys know that grapes have grapevines, so we can actually veer off and be more specialized. So with billing and collections, we can be a coding supervisor, so if we do billing and coding. With sterile tray setup and minimally invasive procedures, we can go to a procedure specialist where we would actually be the ones just helping out with procedures all day. It can be kind of rare, but it can happen. If you know how to work in the lab and know how to do phlebotomy, you might be able to get a hospital phlebotomy job, working nights, going to patient bedsides. You can work during the day, but I know that that doesn't always happen. You can also do medical record supervising. So if you work really well in medical records, that's something that you like, you can become a supervisor. If you like scheduling and care coordination, you can become a front desk or a scheduling supervisor as well. Most of these do have room for you to be a supervisor with. Now, with this top little curly whirly I've got here, there are a lot of different things that we can do as far as continuation of education. So things that we can't get to learn while being a medical assistant, we'd have to go back for this. So we could be a clinic supervisor. We can go to school to do any kind of clinic or healthcare management. We can go back to school if we feel like we would like to be a nurse, a physician assistant, or maybe a nurse practitioner once we're done doing nursing. We can also go back to school to become surgical technicians if you do like those minimally invasive procedures. We can go back for x-ray tech. We do limited scope already, some of us, so we can do that. And we can become sonographers if we would like to do that as well. I know that's something that a lot of people like. So there are a lot of different places that we can go up or across into different areas of the medical field. It's not just patient care that we do, which is how it makes us a little bit different than nurses. So hopefully you guys enjoyed my video today. If you have any questions, make sure you leave them in the comments box down below, and I will see you guys in my next video. Thanks, guys.